Hello everyone, welcome back to our medical channel. Today we will discuss an important thoracic surgical procedure called decortication. This surgery is mainly performed in patients suffering from chronic empyema or pleural infection. What is decortication? Decortication is a surgical procedure in which a thick fibrous layer called a peel is removed from the lung surface. This fibrous layer restricts the normal expansion of the lung and cause breathing problem. By removing this layer, the lung can expand normally again. Anesthesia preparation. Before starting the procedure, the patient is given general anesthesia, and thoracic surgery's double lumen endotracheal tube is commonly used for lung isolation. Standard monitoring includes ECG, blood pressure, oxygen saturation, and capnograph. Surgical procedure. The surgeon makes an incision in the chest wall and enters in the pleural cavity. After exposure, the thick fibrous peel covering the lung is identified. Using surgical instrument, the surgeon carefully separates this fibrous layer from the lung surface. This step must be done gently to avoid damage to the lung tissue. Once the fibrous peel is removed, the lung is allowed to expand fully. Chest tube placement. After decortication, bleeding is controlled. A chest tube is inserted to drain air, blood, or fluid from the pleural cavity. Postoperative care. After surgery, the patient is shifted to recovery or ICU. Pain control, chest physiotherapy, and breathing exercise are important for recovery. A chest X-ray is usually performed to check lung expansion. Conclusion. With proper surgical technique and post-operative care, most patients recover well after decortication surgery. Thank you for watching. Don't forget to like, share, and subscribe for more medical education videos. Thank you.